What role does homeopathy have to play in the treatment of the skin, its disorders, and in its maintenance?
As you said, skin is the largest organ of the body. And when we talk about skin, it is not the only external skin. Skin is internal also, external also. And all external symptoms, they first come on the skin. They are the indication, they are the cry of help of internal disorder.
Skin allergies seem to be very common, particularly in countries that have a particular kind of climate. According to the latest figures from the World Health Organization, skin disorders seem to be increasing. Why, Dr. Bakshi?
The main reason for allergies to spread today is the food what we eat contain maximum amount of insecticides, pesticides. Second is the pollution, the preservatives, the colors, and more away you're going from nature, you're bound to suffer more. The whole body is becoming toxic. So when the body is toxic, allergens, they react, and when they react, the histamine comes out from the skin when the cell is broken, and that gets locked in the skin and causes inflammation. Allergy produces one symptom, you must remember, inflammation. Dermatitis, itis. Inflammation on the skin is an indication the body is suffering internally.
Does the color of the skin have an impact on your overall state of health?
We have done research. We have been to different countries, and we have seen that doesn't make any difference. Only climate makes a lot of difference. For example, in Asian countries where you have, this is a tropical area, you have a lot of heat. When the heat is there, skin problems, they crop up in the form of rash, itching, eczema, and lichen planus, dandruff. But in cold climates, like European countries, and I've seen in Russia, they suffer more from psoriasis. Now, psoriasis is a condition which is usually worse in winters, and as the summer starts in, it gets better. It is not eradicated, but it gets better. And eczema or all other skin problems are worse in summers.
Dr. Bakshi has talked about eczema and psoriasis, which are two skin disorders. Are they the same, or is there a difference between them?
All skin problems, when I'm talking of this eczema, psoriasis, dandruff, lichen planus, they are all basically of allergic disorders. Allergy is always hereditary. It's very wrong to say what is the cause of allergy. The cause is only one simple, that is hereditary. When we take the family history of the patient, you'll find either maternal side or paternal side, they have skin disorders or respiratory problems. In respiratory, you have tendency to catch cough and cold, sinusitis, asthma, bronchitis. And when you have allergies in the family in the form of skin and respiratory go hand in hand, then you're bound to suffer from respiratory problems.
Millions of people are listening to you talk about the skin as an indicator of the overall health of a person's body. You've talked about skin disorders being, to some extent, hereditary. But please assure us, if our parents have had some kind of skin disorder, are we condemned to have the same disorders forever, or can homeopathy treat us?
For skin disorders, homeopathy offers the best treatment in the world. I repeat, best treatment is seen in homeopathy. And all other applications, when you apply steroids, creams, they suppress the problem. Homeopathy does not suppress the problem. It treats from the root, and immunity is built up. And within few weeks and few months, the ointments are tapered off, the oral medicines are tapered off, and patient is feeling much better. The symptoms of improvement is you see the healthy skin coming. Itching is less, scales are less. If it is a dry skin disorder or wet disorder, you will find overall improvement.
Tell us about the relationship between homeopathy and the treatment of alopecia.
There are two types of alopecia. One is of genetic origin. One is acquired because of some other cause. Mostly, which are of allergic origin, they are very easy to cure. But if you have a very strong history of baldness in the family, either in the paternal side or the maternal side, then alopecia is not curable. Remember this. You can only go for hair transplant. Homeopathy helps, but in not all the cases. But we can definitely delay falling of hair through homeopathy. But genetic predisposition, I can see the patient and tell you when you have receding hairline. When you have receding hairline, it indicates that either the father or the grandfather is suffering from baldness.
Dr. Bakshi, we want you to tell us very clearly and in a straightforward manner, all these miracle cures that are being promoted and that promise us spectacular hair growth or hair revitalization, are these just publicity gimmicks?
See, falling of hair is because, as I said earlier, the cause is internally. The hair follicles, they get inflamed. When the hair follicles get inflamed, hair keeps on falling. But the problem is not falling. What rate you have falling of hair, with that rate the new hair are not coming. So genetic predisposition has to be controlled. All external applications are only temporary relief, will not cure the patient. I always say one line to all my patients, in the name of God, we do bigger sins. And same, we sell these external applications that you'll get your hair back. If you have a strong history of baldness in the family, maternal or paternal. I repeat again and again, all patients think the maternal parents are not important. They are equally important. It depends where your genes have gone. And all external applications are only temporary relief, will not cure you, will not cure falling of hair.